Hi, everyone. I'm Michelle, co-founder and CEO of Stellation Care. We measure physician strength and match patients with doctors personalized to their health needs. Did you know that every year there are 7 million hospital admissions that could be prevented if patients saw the right doctors for their health needs? If you're healthy, this may be hard to imagine. Why is it so important to see the right doctor? Well, let me tell you a story about Paula, a patient on Medicaid. She's 34, Hispanic, has asthma and depression, and is juggling 2 jobs and kids. She recently moved to a new place, got on a new health plan, and is supposed to pick a doctor, but got overwhelmed by the long list. And so ultimately, her plan ended up assigning her to Dr. Smith. But Dr. Smith is 2 bus transfers away, doesn't speak Spanish, and isn't very experienced with managing patients with complex behavioral health needs. And so because Paula isn't getting help for her depression, she often misses doses of her asthma medication and then ends up in the ER due to a bad asthma attack. This leads to worse outcomes and higher costs for both Paula and her health plan. And this story plays out for millions of Americans. Of the 93 million Medicaid members, over 70% of them don't have a regular PCP. This is not only bad for patients, it's expensive for payers. In fact, last year, payers spent $310 billion in unnecessary costs due to this problem. So why does this happen? This is due to a patient-provider matching problem. Health plans are unable to connect patients with the right doctor because they lack the right data set, provider performance analytics, and matching tools. This is also a really challenging problem. It's hard to bring these fragmented data sets together on the patient and the provider, and even harder to measure which doctor will drive the best outcomes for which patient. Stellation solves this problem. Our solution is built on 3 components. First, our comprehensive data set on patients and providers in Medicaid and Medicare already provides value to customers out of the box, and it's continuing to grow as we bring on additional customers. Second, our provider scoring and analytics provides the most accurate view of which doctor will drive the best outcomes for which patient. And finally, our matching product allows health plans and members to take action on these analytics. We then deliver all of this via an API that is able to be integrated into the existing ways members are already receiving information today about providers. And this applies to not only primary care, but also specialty care and network design. Unlike traditional provider directories that are just lists of doctors, or newer solutions that provide information about quality, but only measure it based on the doctor and not based on patient characteristics, Stellation is the only personalized solution that matches the patient's health profile and preferences with the provider's clinical strength. And this is what allows us to significantly improve upon the outcomes and cost savings generated. Our team has been working to solve this problem for years. I spent time working in outcomes measurement in Medicaid. Diana, my co-founder, spent her PhD developing the data science behind our product. And Dan, our founding engineer, used to lead the team at Bright responsible for the provider directory and member experience. We have spent the time proving that our product works. In a study with the Veterans Health Administration, we showed that better patient PCP matching can reduce hospital admissions by 22%. And in a randomized control study with a health plan, we showed 10% total cost of care savings. It is no surprise that customers are excited to work with us. In the last few months, we began working with our first paid customer, Innovista, which is part of one of the Blue Cross Blue Shield plans. And we've also started contracting with Geisinger, which is now part of one of the largest health plans in the country. As we look ahead at our pipeline, Stellation is now touching over 1,000 patient lives, with hundreds of thousands more in contracting and millions to come very soon. We've chosen to start with Medicaid because it is a massive market that is underserved today, a $5 billion market. Medicaid plans are also required to assign patients to PCPs, and new regulations are now making patient and provider data more available for our solution. But while we're starting with Medicaid, matching can improve health outcomes for all patients. And as we expand to Medicare and commercial, our market size grows to $17 billion. Our vision is to empower all patients to get the best care for their needs with Stellation's best-in-class platform. Please connect with us if you're excited to join us on this journey. Thank you.